WHC at the very core is ensuring that every individual and community have access to health services without the risk of financial hardship. But not just any service, quality health service, people center that covers the whole spectrum of care. That includes promotion of health, prevention, rehabilitation, treatment, and palliative care. But have we had access to that? No. You and I know that. So the average Nigerian, remember how I said I wanted to make healthcare a basic human right? Let's talk about the average Nigerian. For me, to get access to healthcare, I have to pay for transportation, correct? So after I pay for transportation, I'm gonna go see the doctor. If I go to the facility, if I'm lucky, I see the doctor within 4 hours. If not, they're gonna ask me to come back the next day. Then they're gonna get a specimen. That specimen, law and forbid, you have to pray to the gods it doesn't get lost. Because if it gets lost, you have to go back. Correct? That's your healthcare system. So now, if you go to the doctor, they're probably gonna prescribe you something, right? So when they prescribe you something, you have to buy it at that doctor, which is 3, 4, 5 times price of what you can buy it outside. If you don't buy it at that doctor, you have to, they're not gonna write the name of the drug, correct? My dear pharmacists? So that is the challenge of the industry today. So how can we expand healthcare? So with the universal healthcare coverage, I want you to imagine it just like an umbrella. Okay? The umbrella where healthcare or UHC is to protect us from health issues. Making healthcare affordable, meaning no one should have to choose between basic food and medicine. Making it accessible, meaning there shouldn't be any wait times. Comprehensive, meaning there should be prevention, promotion, treatment, and cure, right? But that is not happening. If you're gonna look at data, 50% of Africans don't have access to basic health care. So what does that mean with our umbrella? We have a leaky umbrella. Correct? So now let's look at the data. According to the UNC report, access to essential health for African regions averages in 2019 to 2021 around 43 to 44%, while the global regions are enjoying at 68%. Let's talk about financial hardships when it comes to the averaging of global regions in comparison to Africa. So, next slide, please. So, the global average of financial hardship is 21% in regions, and the African region is 36%. What does that mean? 36% of the population are actually experiencing catastrophic financial spending. Catastrophic healthcare financial spending. What is that? Catastrophic healthcare spending is actually when the out-of-pocket cost is bigger or higher than what a person could actually afford. So imagine 36% of our population is actually experiencing that. Let's talk about access to basic things, which is clean water, right? So according to the WHO report, 58% of the population have access, African region have access to clean water, in comparison to the 85% that the global regions are enjoying. So let's talk about safe management of sanitation services. According to WHO, the African regions enjoys a 31% safe sanitation services. However, in comparison to the globe, it's 81%. So that means basic things in a global stage that they're enjoying at 81, access to safely managed sanitation services and access to clean water at 81 and 85%. Africa is lagging behind seriously. Let's talk about physician density. The WHO recommends that safe doctor-to-patient ratio is 1.6 doctors per 1,000 population. That translates to 1 doctor per every 625 people. In Africa, currently it's 0.2 doctors per 1,000 population. So that's 1 doctor per every 5,000 patients. That is not safe at all. Let's talk about hospital bed density. According to WHO, the safe bed to patient population, hospital bed population is 2.7 hospital bed per 1,000 people. The African regions have at 1.5% or 1.5 hospital bed for every 1,000 people. Let's talk about healthcare workers and ratio to patient. WHO recommends 4.45 physicians, doctor, nurses, and healthcare providers to 1,000 people. Currently, the African region's at how many? 1.55%. That is some serious data. So let's go ahead and play another video. So you see, about 2 to 3 years ago, I had the privilege of meeting a young, beautiful doctor in the state of Abuja. Her name is Otas. And I kinda jokingly told her, "Doctor, how come you're not a supermodel?" Because she looks stunning, tall, beautiful, the perfect description of a Nigerian woman, right? And she said, she looked at me in the eye seriously and said, "Gia, you know our country needs doctors. And my dad, who is a chief in Benin, have told me that we need to be of service to our people." However, she told me that she couldn't help but get frustrated by the lack of resources, the lack of government support, the lack of funding, and the lack of interest of the citizen to be healthy or even be interested to their health. So she's very frustrated. And she told me a little bit of an anecdote. She's actually a fashion designer as well. She went to the market to buy cloth for the fashion things that she's doing, right? And there was a mom who was breastfeeding with her children selling the cloth. This mom started becoming lethargic. She's weak. She has slurred speech. So the doctor in her came out and said, "Ma'am, you don't look okay. You need to go see a doctor." You know what the sales lady told her while breastfeeding her child? No, I'm okay. We cannot afford to be sick." You can relate, right? Who can afford to be sick? So the doctor in her, knowing the criticalness of the situation, she told the lady, "Ma'am, I have a blood pressure in my bag. Can I kindly blood pressure machine? Can I kindly just check your blood pressure?" And this is true story. She checked the blood pressure. True enough, the BP was critically high. So she was rushed to the facility together with the breastfeeding people. Had this looked at that destiny, had this doctor, beautiful young doctor, not been there at that moment, that baby that she was breastfeeding and those children that was there, they could have lost a mother. So looking at the facts that I showed you, with 1 beds to 1,000 people, we have serious challenge when it comes to expanding UHC. However, there's light in the tunnel. There's room for growth. I have been traveling to Nigeria. It's actually my 11th time being in Nigeria today. And what I have learned about Nigerians and Africans in general is you guys are resilient. Right? And you love jollof rice. And suya. Okay? And you know, technology could actually be a tool that could amplify and grow exponentially that resilience, right? So let's talk about digitalization in healthcare. Let's move on. Imagine that umbrella that I showed you earlier. If we involve technology, if we digitalize healthcare, we could actually modernize that small personal umbrella that I showed you to a big modern tent such as this one. According to research which the esteemed Abu Mukhtar talked about earlier, with all of the plans in place, they're actually predicting a 20% increase into healthcare access with the use of digitalization of healthcare, with the use of technology. So Innovative has taken the challenge of being your tent, of building and providing access to where technology is right at your fingertips. Healthcare is right at your fingertips. So may I ask the crowd, who among you guys have children? Okay. Have you ever traveled to another country? Yes, right? So when you travel to another country or another state, you bring the whole pharmacy. Because you don't know if your child is gonna get sick, and you don't know if that medication is the same medication as that country, right? But that shouldn't be the case. Because a doctor in Nigeria is the same as a doctor in Cameroon, the same as a doctor in UK, the same as a doctor in Asia. Cardiologist is cardiologist. Orthopedic doctor is an orthopedic doctor. But we are not connected. So there's gotta be a better way to do this, right? Did you know that according to GWA's the Mobile Health of Africa 2022 report, they have actually, 2022, they said time is up, I have to wrap up. They've actually jotted down that there's 649 million unique mobile phone users in Nigeria and Africa alone. So they're predicting that to be 800 million by this year. Imagine if we could utilize that and we could use the power of that technology to provide health at your fingertips. So because my time is up, I'm gonna go ahead and show you what innovative is all about. This is a 2-3 minute presentation, sir. If you would indulge me, can we forward to